Welcome you into CommonWell TV, where we're interviewing some of the top healthcare IT industry experts and how their organizations are assisting in worldwide interoperability. It's time now to hear from Amy Shellhart. She is the Senior VP of Product Management for WellSky. And Amy, greetings. What are you most excited about when it comes to how interoperability can continue to impact healthcare in 2020?
Yeah, well, I think there's a lot to be excited about this year, in particular with the final rules being published that we just learned about. From my perspective, one of the most exciting things is the ability to kind of bridge those gaps and transitions in care. Many providers that we represent, clients that we represent in the post-acute care setting, are a little bit blind to what has happened to the patient before they've received them. And so, with some of the new rules regarding notifications of admission, discharge, and transfer, as well as the advancement of the continuity of care documents, we're able to bring that information into our systems and share that with the providers of care so they have a more holistic view of the patient. I also think another thing that is exciting is the way that we're bringing the patient or the person into the story. And so, also with the final rules, we have expectations for patients and persons being able to see their information, be more informed about their own care, and be able to participate in those discussions in a meaningful way. So to me, 2020 is kind of bringing together this 360-degree view of the care of the individual and really putting them at the center.
Well, when it comes to interoperability and just saying this on the surface level, why is it so important to your organization as well as your clients? But maybe you could dig a little bit deeper on that.
Yeah, well, as I said, because we represent predominantly post-acute care and community care, so our individuals are often those who have been users of the acute care system. The highest users of the acute care system, typically hospitals, are older people, those who require more assistance. That's why we have home health and hospice as part of our offering suite of solutions. And they are really the most vulnerable for kind of falling through the gaps. And so what interoperability does is it allows us to bridge those gaps and make sure they have a better experience and make sure that we can take care of them in the home setting where frankly most of them want to be, and help them avoid having to go back into the hospital setting, where really they're not in their natural routines. It's fairly disruptive to their life. And so by having the information flow freely between the inpatient setting and the post-acute care community setting, clients are really able to stay in place and stay at home where they want to be.
Amy, WellSky has seen the benefits from being a part of the CommonWell Alliance. But if you were to share some information or maybe set a record straight when it comes to misconceptions about CommonWell, what would you tell that potential organization?
Yeah, so it's interesting because CommonWell has been an organization for many years, and so some people you talk to are like, "Well, CommonWell, they've been around forever, so that must be an old approach to interoperability. What about the new ways of doing things?" And what I try to explain to people is actually CommonWell is at the grassroots level, and while yes, it took a while to build up the network, the work that's been done doing that is absolutely invaluable. And in fact, because it's a group of participants, those of us working in technology, we're doing a lot of innovative things. CommonWell promotes a lot of the activities that occur within the HL7 fire groups and others. They're actually often leading the way in terms of the standards. They're frankly representing us at a regulatory level and often driving and shaping the way that those rules end up being designed, which are really in the best interest of the patient and the organizations like ours that want to support the clients and the providers in caring for them.
Yeah, so leveraging CommonWell, WellSky is how are they intending to really get their hands on some of the things that CommonWell has to offer and really be able to assist with your client base?
Yeah, that's a great question. So I think interoperability, just for interoperability's sake, right? Being able to say, well, I connect to another organization is not that's not the end of the story. And where the story really gets real is for the end user of the system. We consider usability as a part of our DNA. In fact, we just unveiled our usability lab where we bring in individuals that learn to work with the systems and give us feedback on how that's working to help them execute their jobs every day. So we think the way we can leverage CommonWell is to take those capabilities and build them into our system in a way that's seamless to the end user, that they can just get their job done without even having to think about the technology. And while we're grateful to CommonWell in the background, we don't want them to have to think about CommonWell. We don't want them to have to think about the WellSky solution. We want them to just be able to think about the patient. And that's what's exciting with the services and solutions that CommonWell has.
All right, so that being said, and final question, how does better interoperability help a better end user patient experience?
Well, I think it comes back to that discussion about, gaps in care, and not only gaps in care, but also holistic, thoughtful care. As a country, we keep trying to figure out how do we better get our arms around cost and quality of care. With transparency, there's a couple of things that we have visibility to. One is maybe a test has already been run. We don't need to run that test again. It's an unnecessary expense. Maybe a medication was prescribed during the hospital stay that the patient wasn't taking prior. And now we need to make sure that information gets back to their primary care physician or maybe to the home health agency that's taking them under care to make sure the patient's properly educated and understands you need to start taking this and this is why, and able to reinforce the message. In fact, we know one of the leading causes of readmissions from a hospital is medication mistakes. They didn't know they were supposed to take something new, or they had a different dose that they're supposed to start taking. So interoperability provides that visibility to both the patients, their families, and the providers to reinforce that longitudinal care plan in a way that drives the best cost and quality outcomes.
Well, WellSky this year will be delivering some CommonWell services to their clients. And for more information on WellSky, we invite you to log on to CommonWellAlliance.org for a litany of more information.